here what we are discussed means in previous video we have discussed what is meant by giardiasis, what is the definition, what are the etiological factors, and what is the pathophysiology. Okay, up to that we have discussed already previous video. Okay, in this video we are going to discuss about giardiasis clinical manifestations. Once the children will be affected by this disease condition of giardiasis, okay, what are the symptoms we are identified on the children? Okay, in this the symptom, that is the acute or chronic diarrhea. Okay, sometimes some children are showing acute diarrhea, means in a day 3 or 4 times they are excreted their stool up to 2 or 3 days or 4 days. Okay, some children are showing chronic diarrhea, means 3 or 4 weeks. Okay, 3 or more than 4 weeks the child will be suffering with the diarrhea disease condition. Okay, these symptoms we are identified in the children who are affected by this Giardia lumblia infection. Okay, next one is another symptom like malabsorption, means the child is able to take some food. Okay, the food should be digested, but through the intestine some essential enzymes or some energy will be absorption. Okay, some minerals will be absorbed. Some due to this type of infection in the children there is no absorption of essential enzymes. Okay, here the child will be lose some enzymes or some energy. Okay, next one is the child will have the weight loss. When we are checking the weight of the children, those children are having loss of weight. Okay, less weight. Their day-to-day life they are losing their weight. Okay, next failure to thrive, means they are having the growth failure. Okay, there is no proper growth and development according to their age group. There is no physical growth and development or mental growth and development. Okay, next another one is the abdominal pain. Many of the children complaint, many of the children suffering with the one symptom like abdominal pain. Next another one is the anorexia, loss of appetite. They are complete avoiding their food. Okay, they are not taking proper food materials. Next nausea or flatulence. Sometimes the child will be suffering with the gas not releases. Okay, next some children are showing one common symptom like fever. Okay, the body temperature should be raised than the normal body temperature. Next another symptom like some children are not showing any physical signs, means there is no fever or there is no abdominal pain or there is no diarrhea. Okay, or there is no anorexia, means in their body some infection will there due to the Giardia lumblia, but they are not showing any clinical manifestations. Okay, these symptoms also there in the children. Next another symptom like some type of acute or severe cases we are identified one dangerous disease condition or one dangerous symptom, that is the dehydration. Okay, the body completely dehydrated. Why? Because due to the loss of fluids or due to the loss of fluid from the body from the diarrhea or vomitings. The child continuously vomited means the fluid will be lost, or the child continuously having loose motions or diarrhea means the body will lose some type of fluids. Okay, due to that we are identified dehydration or dry skin or dry lips or sunken eyes. Okay, in the children. Next one is the malnutrition, their body not having sufficient nutrients in their body. When we are identified low weight or less weight, okay, height also less, or their body mass index will be less, their muscle strengthening very thin. Okay, there is no sufficient nutrients in their body. Abdominal distension. Sometimes the children are not having any physical symptoms. The fluid or the food or some waste products complete, the gas will be complete obstructed in the abdominal region. Due to that, the child showing abdominal distension. Next, tenderness, or sometimes when we are examining the stool of the children, there is no blood or there is no mucous membranes in the stool. Okay, these are the symptoms we are identified in the children who are suffering with the Giardiasis condition. Next, diagnosis. How we are diagnosis means depending upon the history collection. Another one is the physical examination. In the history, we are collected history regarding appetite. You are having good appetite or less appetite, or what is your weight, what is your height, okay, what is the children's problems, okay, is there any dehydration, or is there any abdominal pain, or is there any abdominal distension, or is there any growth failure, that will be collected history from the children. The children are able to give information means we have to collect, or the children are not responding means you go for their mothers. Why? Because the mother will give complete data regarding children. Okay, we are collecting history from the mothers regarding children's health. Next, physical examination. In the inspection, what is the children's health physically? Is there any problems? Or in the palpation, we have to palpate the fever, means the body temperature is increased or decreased, that will be identified. Sometimes in the percussion, we have to identify is there any abdominal distension, that will be identified. Okay, these are the steps we have to follow regarding diagnosis of your children. Okay, another diagnostic findings like aspiration of duodenal materials. Okay, this is a major one. Duodenal materials is there, that will be aspirated for detection of Giardia lumblia organism. Okay, by collection of duodenal materials, we are testing in the laboratory for identification of Giardia lumblia microorganism. Okay, next another test, that is the ELISA, enzyme linked immunosorbent assay test. It will be identified for the parasitic infection that will be there or not. Next, another one is the intestinal biopsy. Okay, in the intestinal biopsy, what happens means from the infected intestines, okay, some part will be taken out, okay, for detection of which microorganism is be there or which infection will be there. The infection will caused by the hookworms or pinworms or tapeworms or Giardia lumblia. Okay, what is that particular organism is there in the intestine, that will be easily identified by doing the intestinal biopsy. Okay, next these are the diagnostic findings. Next, we are discussed about management. Okay, in the management, we have to administer some drugs for reducing the disease condition of Giardia. Okay, in the drugs, what are the drugs is there means especially metronidazole. Okay, the drug name is the metronidazole. The dosage is the 15 milligrams per kg body weight per day. Okay, in a day we have to administer one drug. The name is the metronidazole. Dosage 15 milligrams per kg per kg weight of the body. Okay, next we have to administer another drug, that is the albendazole. Okay, in this albendazole, this dosage is the 400 milligrams. Okay, that will be administered once in a day. Okay, in a day we have to administer one time or single time. Okay, the drug is the albendazole. Okay, next one is the furazolidine. Okay, the furazolidine or tinidazole. Okay, furazolidine or tinidazole. this will be drugs we have to administer. The dosage is the 50 milligrams per kg body weight for control of this type of giardiasis disease condition. Next, these are the drugs. Okay, these are the medical management. Next, as a nurse, what is your role? What you are doing means in this we have to provide a protein rich diet to the children who are suffering this type of giardia disease condition. Okay, those type of children improve their health status. We have to provide which diet having proteins richest. This type of diet we have to give to the children. Next, another one is the vitamin A supplementation. Okay, some vitamin A drops we have to administer to the children. Okay, next, avoid high spicy. Okay, when the child is taking some food means there is no spicy, reduce or less spicy food we have to provide to the children for control of giardia disease condition. Okay, next, fried food materials. Okay, some food items will be always taken fried. Okay, do are not doesn't provide fried food to the children. Okay, this is the management. Next one is the prevention. Okay, in this prevention we have to provide health education regarding frequent hand washing. Okay, frequent hand washing with the fingers and fingernails. Okay, why? Because some microorganisms or sometimes the eggs or the cyst will be there in the fingernails, means accumulated in these fingernails. Okay, due to this the infection will be easily spreading through the mouth when we are taking some food items. Okay, that's why complete or always we have to strictly follow the hand washing techniques up to fingernails and fingers. Okay, next another one is the not eating unwashed fruits. When we are buying some foods or some fruits or some vegetables, okay, the food items or the vegetables should be complete cleaning, means complete following the hand washing techniques and the cleaning process. Okay, next one is the sometimes the child having infection regarding giardiasis, one doubt is there, means then immediately we have to provide boiling drinking water to the children. Okay, due to the boiling water, 3 minutes we have to boil river water. Okay, in that 3 minutes due to boiling, the giardiasis or the Giardia lumblia microorganism should be killed. Okay, means the water should be purified. The water should be filtered by the boiling process. Okay, that's why once the child having one doubt regarding giardiasis disease condition means immediately we have to provide some boiling water for drinking. Okay, for prevention of disease, for improving their health, for control of infection, we have to provide drinking water. Means sometimes the child or the family members are not able to take purified water or drinking water, then we have to do this type of process. For boiling water, we have to improve the health of the children. Okay, this is regarding prevention of giardiasis disease condition. Thank you everyone.